So just for all of you to understand what that would be like. So what is very important is that we get all the information about your child. So a lot of information is taken with the help of a detailed questionnaire where we want to understand not just about the behavioral issues, but we need to understand what is what are the gut health, what is your child's gut health, what is the sleep like, if there are any allergies, so various things, because everything is so interconnected. The liver health, the gut health, the sleep, um, the immune system reacting, all of these are so connected. So a very detailed history is very important for us to understand what the child is going through, and then accordingly we have to advise investigations which will help us identify, connect those dots with the sign and symptoms. So a detailed understanding of the sign and symptoms along with investigations where we can get information about the about various organ function, about the inflammatory markers, about heavy metals, about the gut dysbiosis, candida overgrowth, mitochondrial health, the complete vitamin profile, minerals, etc. So once all this information is there, then we can do a root cause analysis to identify what is at play in this particular child, whether it's the heavy metals, um, the the gut infections, there are deficiencies, there is the liver needs support or the kidney needs support. So all of these can be identified with the help of information that we get from a detailed questionnaire and the sign and symptoms. Now, so once the root cause analysis is done, then a detailed treatment plan can be designed where we can um, use various tools to address these root causes. Now, what will be these tools like? So the first and the foremost is the diet. That's a basic thing to start with. We have to start with eliminating everything that's inflammatory and then add things which are non-inflammatory and will help in the recovery process. So there will be a lot of focus on the diet aspect, and a lot of nuances are there. So for instance, um, when gluten is eliminated, the most easiest thing that is added by most parents is rice, white rice, but then that is detrimental. So we have to choose the right kind of alternative when we are removing gluten. So it has to be gluten-free flours, which can be millet-based. It can be millets in place of rice. So a lot of those options have to be included, along with a lot of veggies. Cut down on the high glycemic fruits. So a lot of those things will be focused on. Then, of course, a lot of lifestyle changes. And here it's not just about basic lifestyle changes, but for example, the kind of light your child is under all the time, the kind of technologies that a child is exposed to. A lot of focus will be on all of that. Then comes nutraceuticals. Now, nutraceuticals to address the deficiencies, to address the gut health, to support the liver, etc., etc. Now, these supplements are for a certain period of time until we address why it's needed. And these are very safe. Parents often have a question: are the supplements safe? My child is small. Will he or she be able to take these supplements? Each supplement is selected based on the need of the child. And therefore, a certain period of time, there are absolutely no side effects, and everything is very carefully chosen and given for that specific child. And then, of course, the consultation happens where you are explained everything. Now, to help the parents implement the plan better, understand the logic behind everything that has been advised, we do a lot of empowerment. So these are education sessions for parents where parents have to take out time and attend these live sessions that Dr. Ashwani conducts, so that you can understand why we have, for example, why we've advised this particular diet, why these lifestyle changes are advised, what is the role of the gut health, how can you improve the mitochondrial health, uh, why these kind of tests are advised, why these are kind of supplements are advised. So the live sessions will help parents to understand the logic, the reasoning behind uh, the guidelines that has been given, and it's also an opportunity for parents to interact directly with Dr. Ashwani during these live session and ask your questions. Apart from that, of course, you will have support on WhatsApp anytime that you need help, so that's there. So it's a very collaborative approach. Only us giving a treatment plan will not help. Parents have to be very actively involved in this entire process. And really, here parents play a very instrumental role in really helping their child recover. We can only guide, we can make, will make the best treatment plan for the child, but end of the day, it's the parents who can ensure that you implement the plan to the T and get your child out of out of this diagnosis. So with that, of course, if you check this page of ours, you will see a lot of testimonials there, a lot of parents who had shared their journey with